Hello, I'm Dr. David Musnick, MD. I work at Functional Medicine of Idaho in Eagle, Idaho. I'm going to be talking on this video about scars and the effect of scars on the body and about a treatment that we do here called scar neural therapy. So, scars can be caused by any number of things, most commonly from surgeries. And they can also be caused by burns, by cuts. Any kind of scar on the body could cause a problem in regard to a number of issues. Number one, motor strength, muscle strength. That can mean, like, is a muscle firing as strong as possible? So a good example of that is a woman has a C-section scar, or a man has an abdominal scar, and the hamstrings don't work as strong, or the glutes don't work as strong, because of what's called aberrant signaling coming from the scar to the spinal cord and then interfacing with the muscles. So that's called recruitment dysfunction from scars. So sometimes and often we can get muscles working stronger by treating the scars. Another thing scars can do is they can restrict range of motion. So someone could have a restricted range of motion of the shoulder or the neck, and then get the scar treated, and then the shoulder and the neck it moves better. An example of that is I had a patient recently that actually had two scars, a thyroid scar and a C-section scar. And she just wanted her thyroid scar done. She gained 20 degrees of range of motion and rotation like this, but she didn't quite have all the motion. And then we injected the C-section scar and she gained all of it. So that's an example of range of motion. Another thing is scars can contribute to pain. So scars can be painful themselves, or scars can actually lead to chronic pain. And when you treat the scar, the pain level can go down. Another thing is scars can be related to internal function. So you could have someone that has scars on the abdomen, scars get treated, then we have better abdominal function. Like someone who's constipated that had the scars on the abdomen treated and now is having bowel movements on their own. That's just one example. Or we want to increase the motility of the gut, treat the scars, and the motility of the gut works better in like small intestinal bacterial overgrowth or other internal conditions. The scars can also affect the heart, the lungs, other organs. So internal organs can be affected by scars. So how do we evaluate this? Well, when I evaluate people, I find out what their symptoms are, find out what scars they've had, find out if any symptoms develop within a certain period after the scars. Then I test the scars on physical exam, and I see if people are a candidate for scar treatments. And I test every one of their scars to see what treatment of the scars might do. So what kind of treatment can we do? We can treat scars with laser. We can treat scars with microcurrent and probes. So if we do it with laser, we do it with the probes, they don't feel it at all. But the gold standard is usually injection of the scar with a tiny needle and raising the scar a little bit, and that's the gold standard because it works so well. What does it do? It does many things. It reboots the sodium channels in the scar, it breaks up adhesions. And then there's many other theories about what scar injections can do in regards to the mechanism of action. Now, in terms of my experience, I've probably done about at least 5,000 scars on the body. I've been doing it for a very long time. I used to teach this technique. I still do teach it in different courses, but used to teach it to physicians. So, when does it make sense to have scars evaluated? It makes sense to have them evaluated if they're thick, if they're painful, if you have weakness, if you have internal problems that you're wondering, why do I have these problems in my heart, my lungs, something else? Could it be related to a scar? There's no harm in evaluating scars. There's no harm in doing that just to see if treating them might help. And then once you get evaluated, if I'm the one evaluating you, then what we would do is tell you, yeah, it seems like these scars are affecting either range of motion, muscle recruitment, pain, or internal functioning. And then I would say what I think I might be able to benefit. If it is an injection, it really doesn't hurt very much. These are tiny needles. Believe it or not, the higher the number on the needle, like 30 gauge, the thinner it is, and you can barely see these needles. So it barely hurts, and I think it's definitely well worth it. But if someone doesn't want injection, we can use laser or we can use microcurrent with probes. Anyway, scar treatment can be very powerful for helping the body to heal, and we offer this at Functional Medicine of Idaho in the Eagle Clinic.